Welcome back. I'm Erin Brinker.
And I'm Tobin Brinker.
And we are on The Brink, the morning show on KCAA, AM 1050, FM 106.5, and FM 102.3. I am so excited to welcome to the show Dr. Joel Nitzkin. He's a senior fellow in tobacco policy for the R Street Institute. He's a public health physician, board certified in preventative medicine, and his medical specialty. He has been a local health director, a state health director, and president of 2 national public health organizations. Since the mid-1990s, Joel has been in private practice of public health and as a health policy consultant. In this capacity, he has taken on a number of research and teaching assignments for federal, state, and local public health agencies, assisted with the accreditation of a managed care organization, and done substantial expert witness work related to communicable diseases or communicable disease control, quality health care, and tobacco control. He is joining us today to talk about a national movement to regulate tobacco. Dr. Nitzkin, welcome to the show.
Good to be here.
So tell us about, and we are in California, and so in California, tobacco is taxed like crazy. I don't know that it's necessarily regulated like crazy, but this is the FDA plans to regulate nicotine in cigarettes. And how will that affect our California smokers?
Well, there are a number of things going on, both FDA and in California. Basically, the plan of FDA is to reduce nicotine in cigarettes to non-addictive, that means non-satisfying levels, with the idea that if they eliminate almost all the nicotine from cigarettes, smokers will simply quit smoking. The problem is, if they do that without making sure they have other nicotine delivery products available for those smokers who have an uncontrollable urge for nicotine, they're simply going to go to contraband and black market full nicotine cigarettes. The attitude in California is one in which they accept as a fact the idea that flavors in tobacco products recruit teens to first use e-cigarettes and then from there to smoke. That's really not true. The research shows, if anything, quite the opposite as it relates to e-cigarettes. But in California, that feeling is so strong by the California regulators that they're simply going to continue down that road.
Well, that's interesting. My co-host and husband is a middle school teacher, and he sees these e-cigarettes, and actually on the ground, what people are worried about more is marijuana oil in those e-cigarettes as opposed to tobacco.
Well, that's certainly true. It's very hard for an outsider to tell the difference between a marijuana vaporizer and an e-cigarette. Either way, the vapor form of either product is definitely safer than the natural form of the product, but even so, you don't want to encourage marijuana use. But the truth of the matter is, with e-cigarettes, even though lots of kids experiment with them, most of the experimentation is with zero nicotine e-cigarettes. Much of the occasional use is kids competing with each other to see who can generate the biggest exhale puff cloud. And the zero nicotine, zero marijuana e-cigarettes give the best puff cloud.
Well, actually, that makes tons of sense. I could totally see kids doing that.
Yeah.
So, how the FDA, where are they in the process of making it so they're reducing the nicotine levels to an unsatisfying level? How long has this been in the works, and how long until this sort of thing becomes law?
Well, they've been talking about it for about a year or so, and right now they're in the process of seeking comments on it. It will be probably at least 2 or 3 years before that becomes law. And then when it becomes law, it's almost guaranteed to be challenged by the cigarette companies, because the science behind their proposal is very weak and, quite frankly, full of holes. So the future of the very low nicotine cigarette is very much uncertain. They're likely to move more quickly on the flavor issues. There again, they're seeking input. California isn't. They've sort of decided that flavors recruit kids, and they just want to go ahead with it, whether it makes any sense or not in any other context.
So I understand I do understand the thought process of saying, that this would make people, they make the cigarettes themselves less addictive. But, my father's been smoking since he was 13 years old. And when he wants nicotine, he wants nicotine. And I could see people will buy more packs of cigarettes. People will buy them on the black market. And we already have, your local drug dealers now selling, loosies in addition to everything else he sells. And so I think that I agree with you that it would create this black market for selling cigarettes.
Well, the secret to success, and I don't hold out much promise for it right now, is for the FDA and other public health authorities to say, okay, even though e-cigarettes are not totally risk-free, they are substantially lower in risk, like 99% lower in risk than cigarettes. And they're also less addictive, which means that they're easier to quit. We now have experience in both the United States and in Europe with literally hundreds of thousands of smokers switching to e-cigarettes. Then over a period of time, the smoker moving at her own pace, cutting down the nicotine, the e-cigarette to zero, and then quitting both nicotine and e-cigarettes entirely. It doesn't happen overnight. It doesn't happen very quickly, but it does happen. In the meantime, while they're on the e-cigarette, they're using a product that doesn't pose any additional risk for cancer, heart, or lung disease. But the problem is that neither FDA nor the state of California are willing to, frankly, tell people that even though e-cigarettes are not totally risk-free, they are substantially less hazardous than cigarettes and easier to quit.
Wow. So is it just the idea that cigarettes are bad, so e-cigarettes must also be as bad? And, is it just a mindset?
The mindset is the 19th century mindset that tobacco is an evil weed. And therefore, we should eliminate all use of tobacco in American society or in society generally. The truth of the matter is that all of the problems that we're having with both addiction and illness and death caused by tobacco are due to a single product, which is the cigarette, the combustible cigarette. People smoke for the nicotine, but they die from the tar. And that simple recognition should drive tobacco policy, but they have become so accustomed to railing against all things tobacco, neither federal nor state authorities are willing to inform current or would-be smokers of these differences in risk, differences in addictiveness.
Wow. Because what it should happen is that this creation of lots of different products that have the nicotine but not the tar.
There are, in fact, a variety of products that present the nicotine without the tar. There's e-cigarettes. There are the smokeless tobacco products, the snus, and even the chewing tobacco that have been readily available on the American market for decades. And then there's a new line of products that have been tested in Japan and in Europe called heat-not-burn products, where you, using a computerized chip, if you will, you precisely heat a plug of tobacco in such a way that it releases most of the nicotine, a little bit of tobacco taste, but none of the tar. All of those are products far lower in risk than cigarettes, that smokers could switch to, and that are also much less likely to addict teens to lifelong smoking.
Wow. So where do people get more information about this, about what the FDA is doing, and about tobacco and tobacco policies in general?
That's a very difficult position, and it really stresses me as somebody who spent his career in public health, where the information being provided on this topic by public health authorities is just not reliable information. You get better information by going to your local vape shop and having them explain these things.
Well,
where to get information is a serious problem.
That's disheartening.
Yeah.
So where do more people get information about you? I see that you have a website. Are you on social media?
I'm not really on social media. The best place to get information on me is to go to relative tobacco policy, is go to the R Street website, rstreet.org, and then search for my name. And you'll see, statements that I've made, and you will also see a biographical statement in terms of how it was that I, as a public health physician, wound up in the tobacco policy arena and wound up on the side favoring e-cigarettes against most of my public health colleagues.
Well, this has been enlightening. Dr. Joel Nitzkin, thank you so much for joining us today.
Okay, my pleasure.